I don't even know where to start, Vin Gupta, in putting the inappropriate umbrella over all of this. A vaccine should be developed and made available as soon as it's ready to save lives, full stop. If that happens before October and it happens to benefit Donald Trump, I don't think anybody cares. That said, all of the examples of Donald Trump ignoring science, they would start with him leaving a cruise ship off the west coast of this country because he didn't want the infections on board to mess with the numbers, then followed by him saying anyone who wants a test can have one, when you still can't get a test with a result in less than 8 to 14 days that would mean anything to most people. There are still rampant spread. There are still people who won't put masks on. I mean, how out of whack is the president's focus here?
Well, you nailed it, Nicole. This is about an issue of focus because people are scared. There's parents, teachers, school districts, they're scared. Not to mention the broader American public about what does this mean as we enter the fall flu season. We don't have the right focus. You nailed it. I showed this last time. I'm going to show it again because people really responded to it. Point of care testing. I'm not going to show the name of the company, but it's so easy, and we need to scale the right type of testing for schools and for workplaces. You stick something into your nose and you put it in here. I'm simplifying it, but you get the picture here. In 20 minutes, you get a readout and you know with the quality of a lab-based test if you're positive, if you're negative. If we had that focus from the top back in March, we wouldn't now be just talking about a $250 million investment in these types of devices, which is a start, but it's not the scale we need. We need a $100 billion investment in these types of devices for every school district, for every workplace, for every university, because there is not enough of these guys. I'm going to show you another prop here, N95 masks or surgical masks to go around. Right now, there isn't. What we need here is testing, point of care testing, the right type of testing. And it goes to the large point you were mentioning earlier, Nicole. We're having deaths continue to spike. Since the beginning of July, it's been on a steady uptrend. For your viewers, go to covidtracking.com, a good source of truth on data. While testing numbers, not the right type of testing, but testing numbers have declined in the past month. We actually had a peak in testing on July 24th. We've had a sustained decline. So deaths are increasing, testing is decreasing. That's a recipe for disaster.
Let me follow up with you because Donald Trump, I just say that again. So we're testing fewer people, but the death rates are going up. Does that lead you to believe from the data that the numbers of infections are just undiagnosed? Just explain what that means.
Absolutely. So we know two things. We know that for every confirmed case of COVID-19, there is likely, and this is CDC data, there's probably 10 undiagnosed cases of COVID-19. It's why you have situations like you had in Georgia, where a camp had to get shut down because there was a massive outbreak within just a few weeks, even though everybody came with a test that was supposedly negative. So that's number one. And number two, a metric that we don't talk enough about, Nicole, is the number of tests per confirmed cases. So if I go out and test 12 individuals, I'm going to hit one confirmed case. That's where we're at. 12 tests to get one positive hit. Countries that have done this right, largely speaking, South Korea, Australia, they have to test 270 individuals before a confirmed hit. It means, one, we still too narrowly test. As an ICU doc, I still have not been required to get a test. I've been caring for these patients for 6 months. That's one. Number two, we just don't have enough testing. We need way more testing. An analysis by the New York Times suggested 40 states are well below their target for testing. So it's not just number of tests, but again, it's the right type of test, point of care tests.
Donna, there's so much to unpack here from Jonathan's reporting, from Dr. Gupta's insights here into the real truth around the pandemic. But I want to show you something. This article, everyone should read it. It's the New York Post or the Washington Post reporting over the weekend about the running out of unemployment benefits, the larger theme being the economic calamity that is this country right now in its 6th month of a pandemic. Garrett Haake was on in the last hour saying that Chuck Schumer came out and said he's just beginning to understand the other side. I don't think there should be two sides when there is rampant food insecurity from people who had big jobs with benefits 6-7 months ago. I mean, why isn't there more hair on fire, urgent action in Washington to help people who are just slipping, pouring through the cracks?
Yeah, you know, Nicole, I don't really understand the lack of urgency. I mean, my hair was on fire when I heard the first several headlines that you did in today's opening. And then, of course, after hearing Dr. Gupta, I want to close my door and lock myself in from now until I don't even know when. And I think that what is happening here is that even before the pandemic, millions of families who got up and had workers who got up every single day and went to a job still were living paycheck to paycheck, unable to meet the rent at the end of the month, juggling the rent and the grocery bills and the daycare expenses. And now we have a circumstance where millions more are unemployed. There is no prospect for them going back into an economy that simply doesn't exist, for jobs that aren't really there now because the economy can't fully open up, because this administration has not really had a plan or a strategy to either open up the economy, deal with this pandemic, and get the country going again. And, and I think that, I don't know. I mean, I know I have family members and know people who are on unemployment for whom that $600 has been a lifeline that enables them to continue to meet their expenses. And I don't know how long the food lines have to get before particularly Republicans in Congress really see that and say, we're going to come to the negotiating table and we're going to hammer out a deal for the American people. And it really is tragic. And we're going to start to see, if we haven't already, and hear some very, very tragic stories of Americans who are losing their homes, who are not able to make their expenses, and for whom shelter isn't even an option because we don't even have that kind of bed space available. We're reaching a very, very scary point, and it's come to the point, Nicole, where it's not a worldwide pandemic, it's a United States pandemic, and we are not doing anything to address it and to get it under control.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.